64 years old female patient with known case of diabetes and hypertension was presented to the emergency department with a typical chest pain, and on ECG there was a ST elevation in the V1 to V6 with 1 AVL, and there was a reciprocal changes. So after all clearances on echocardiography, there was a RWMA in LAD territory with the moderate LV systolic dysfunction, and after all clearances we proceeded for the angiography. And this is an angiogram with the right radial route with a Tiger catheter, and you can see this is a caudal view. You can see sort of aneurysmal segment in the proximal LAD. LCX is fairly normal. Now let's come to the cranial view. This is a cranial view, and you can see clearly there is a dual LAD structure in the coronary, and you can see just before the bifurcation there is a thrombotic occlusion. Is almost 90 to 95% thrombotic occlusion just before the bifurcation of the LAD, dual LAD. So in this RO cranial view, we can see clearly just before the bifurcation of the LAD there is a 90% thrombotic occlusion, more than 90% thrombotic occlusion with TIMI3 flow. So in this cranial view, in this steel frame, you can see the near the arrow there is a 90% thrombotic occlusions just before the bifurcation of the LAD. You can see the dual LAD here. And the same thing you can see here in this epicranial view with the dual LAD structure with thrombotic occlusions, significant thrombotic occlusions in the just before the bifurcation. So after obtaining all the clearances, the patient was taken for the angioplasty. We proceeded with the same route. You can see the lusoria is there, but somehow I managed to negotiate the catheter and to hook the left main. This is a XB3.0 catheter with 6 French, and somehow I managed to hook the catheter. This is a yellow caudal view, and then BMW PTCA wire was crossed in the LAD, and this was a stent placement just before the bifurcation. This was a 3x20 stent. We just confirmed the position. We confirmed the position in this epicranial view, and then stent was deployed. So this was a stent was being deployed at around 14 atmospheric pressure. It was 3x20 stent, and this was a scene after the stent deployment. You can see this is RO cranial view, and you can see there's no under deployment, under expansion. Stent was. So this was the angioplasty in this anterior wall MI to this dual LAD in the mid LAD. Thank you.